When evaluating a patient for non-surgical rhinoplasty, it's essential to appropriately analyze the nose in advance of the procedure. This includes assessment and caliper measurement of the nasofrontal angle, radix projection, supratip break, nasolabial angle, previous scars, asymmetry, presence or absence of a dorsal hump, symmetry and straightness of the dorsal nasal aesthetic lines, tip projection, alar notching or retraction, and importantly, the presence or absence of prior surgical rhinoplasties. After analyzing the patient, I obtain an appropriate informed consent in which I discuss explicitly with the patient serious but rare risks, including tissue necrosis and blindness. My medical assistant takes standardized medical photographs in 6 views, and topical numbing and sterilization of the nose is performed. When performing a non-surgical rhinoplasty, my key approach is microdroplet injection of a highly dense, highly viscous, high G' hyaluronic acid-based filler. I stay on the midline and stay deep. In addition, I'm always injecting right on the perichondrium or periosteum in an avascular tissue plane just above the bone or cartilage. Prior to injection, I always aspirate for safety and inject on needle withdrawal. Importantly, it helps me to achieve a pleasing nasal result in terms of the aesthetics of the nose by thinking of the filler as if it were a surgical cartilage graft. This is my approach for achieving a tip flip or upward rotation of the nasolabial angle and apparent tip projection. When speaking to patients about non-surgical rhinoplasty, it's important that they understand the limitations of the procedure, including that we are not removing any bone or cartilage or placing any permanent sutures. Indeed, this technique is more of an optical illusion that improves the nasal contour by improving the light and shadow reflexes on the nose. Non-surgical rhinoplasty is one of the most popular and frequently performed minimally invasive injectable procedures in my New York City private practice. As all of us know, over 220,000 surgical rhinoplasties are performed every year in the United States, but this procedure is limited by its invasiveness, downtime, anesthesia, patient desires, and revisions. Non-surgical rhinoplasty has cropped up as a popular minimally invasive alternative. It was first described with bovine collagen in 1985 and has since been described with calcium hydroxyapatite. However, both of these products are limited by their potential for complications and their lack of reversibility. Today, in my practice, I use hyaluronic acid-based fillers for several reasons, including that they are safe and durable with highly cross-linked products, a high G', and the option for dissolvability. Non-surgical rhinoplasty is a powerful and beautiful technique for optimizing the aesthetics of the nose. With precise and safe technique, non-surgical rhinoplasty is an effective and appropriate modality and alternative to surgical rhinoplasty. Avoidance of complications and strict respect of nasal anatomy are needed to ensure best results.